Good morning. As you can see, I'm not wearing a white coat. I'm certainly not Dr. Steve Stites, the Chief Medical Officer at the University of Kansas Health System. We gave him the day off today. He needed a little break. I'm Alexis Delcid, pinch hitting on this episode of Open Mics with Dr. Stites. And today we're focusing on epilepsy. It's a brain disorder and it causes reoccurring unprovoked seizures. For many people living with the condition, it's hard to live a normal life, never knowing when that next seizure will hit. But here's the great news. There are new ways to help people who have epilepsy, and we're going to talk about that today. I am so delighted to welcome some very special guests this morning. We have Alex Crawford with us, who lives with epilepsy, and he's wonderful. We've been chatting about pirates and camp and everything this morning. His mom, Gina, is beside him as they join us this morning. Along with us in the studio, Dr. Carol Ujoa, an epileptologist and director of the Comprehensive Epilepsy Center here at the University of Kansas Health System. And we are also delighted to have Dr. Jennifer Chang, a neurosurgeon here at the health system. We have a stacked cast, so thank you to all of you for being here. Dr. Ujoa, I want to start with you. Right out of the gate, what causes a person to have epilepsy? Is it something you're born with, and then when did the symptoms start?
Well, first, good morning, and thank you for having us here today as we observe Epilepsy Awareness Month in November. So I want to back up a little bit and just say what seizures are. And so basically, our nerve cells are always communicating, and that's how we control our body and the things we want to do. And that's all, voluntary. With seizures, there's this involuntary communication of the nerve cells that are hyperactive. And so that can cause a variety of symptoms. And so epilepsy is essentially someone that has seizures. Their brain has a tendency for seizures. The causes are many. One big area is genetic, and so sometimes it's passed on in families. Other times it's just within that individual's genetic makeup, and it's not necessarily that they have a sibling or a parent with epilepsy. And then really anything that affects the brain, the structure of the brain. So for example, as the brain is forming in the womb, if things don't go exactly as they typically should, we call those malformations of cortical development. That can cause epilepsy. And then things like stroke, traumatic brain injury, a brain infection, things that affect the brain in that way can all cause epilepsy.
Do you know what causes it in a specific person? We're going to get to Alex in a minute, one of your favorite patients who's sitting right beside you. Are you able to go back and figure that out?
Yes, so I think that's one of our main goals when we first meet a patient. And I would say a great portion of time we are able to know the why, but there are still times where we don't. But we really have to do our best to try to figure out the why. And what we find is a lot of times patients we see here, often they've been seeing other physicians, other neurologists throughout their life, and have had MRIs that were read as normal. But we find that with our expertise and the higher quality MRI, often we're able to find a lesion. And so we looked at this and studied this, and about 30% of the time when patients come in being told they had normal MRIs, we actually find an abnormality that is known to cause epilepsy.
I want to go now to Alex and Gina. Alex, you're 30 years old. You've been living with epilepsy for a very long time. So I want to ask you and your mom, how do you feel today, and what has this journey been like for you? Alex, I'll start with you. How are you feeling today?
Well, I don't really know when I'm going to have a seizure, but there are some pretty well, it's kind of hard to explain. Why
don't you tell them what it's like living with your seizures? How's that been for you?
Yeah, well, it hasn't really been an easygoing life. I didn't really have any freedom. I am. I had to have some restrictions. And I wasn't able to go to some summer camps. It wasn't really easy going about it.
One of the things that's remarkable talking to you, Alex, is that you have survived so much. And Gina, you are really a duo. And not only that, Alex also happens to be living with a couple different things that might add more layers to his care. Alex is also living with autism. Gina, has that also impacted how you're able to navigate going through this journey with him?
Yes, because he started having seizures so young. It was really difficult for him to know when he was going to have a seizure because everything felt normal to him. It wasn't a new experience for him. It just is who he was. Mm-hmm. The autism made it a little more difficult. Just trying to get information from him for the doctors. Sometimes we ask questions, and he's very literal, so it's sometimes hard to get the actual information you need. So as he got older, that got a little easier. I do remember he had his first surgery, and they were testing to see how close this area was to his speech center, and they had a list of questions, and they would stimulate the brain. If he couldn't answer, it was too close to his speech, and we wouldn't be able to do anything. And the first question they gave him was, say the alphabet starting with O, and he kind of got a blank look on his face, and we were all kind of drooping, and all of a sudden it hit me. The only alphabet Alex knows starts with A. He doesn't know the alphabet starting with O.
Right.
So we kind of have to sometimes restructure different tests they give him because it's hard, just because the way his brain works a little differently. It works, but it just works a little differently.
Totally.
And so once they did that, we were able to get through the tests, and he did end up getting to have some surgery that did give him a little relief.
That makes so much sense. So how old was Alex when he first started having seizures?
He was 2 days short of being 6 months old.
Oh, wow. And then how often did they happen?
Well, when he was a baby, he had that first one. It was like a 30-minute seizure. That was horrible. But after that, it first started, whenever he had a fever, he was going to have a seizure. And then it went on to, a little bit more where every once in a while we would have a seizure, and we thought we got overheated or something like that. But what we've come to realize is that for some reason, whenever he gets really excited or he's having a lot of fun, he's going to have a seizure.
Oh, that's a nasty twist.
Yeah, but lately we've discovered some therapies that we use, and they've been so successful, and it's just been a really life-changing time for Alex these last couple years.
I want to bring in Dr. Ujoa because, for two reasons. One, you are his epileptologist, but two, Alex just lit up when we told him you'd be sitting next to him out here. And to see the bond that you and Alex have, you first saw him as a patient 8 years ago. Can you talk us through the treatments and procedures that Alex has undergone in his life and how they helped each step of the way?
Yes, so Alex has had more procedures than probably, the vast majority of the patients that we take care of. So before I met him, he'd had another care team, and they pinpointed the seizures to a part of his left frontal lobe, did a surgery to remove some of that. And with that surgery, he went from having about 2 seizures a day to every 5 days he would have a seizure. So there was certainly improvement. Of course, every 5 days is still a lot of seizures, especially when for him it was always the big seizures, what they used to call grand mal, the convulsions, where you fall and shake and stiffen, and those are the most serious type. So the care team at that time also placed a vagus nerve stimulator, or VNS, that helped a little bit additionally. I met Alex in 2015, very soon after starting here, and I just felt like we still needed to do more, and we likely could do better. And so with the support of his parents, we basically started from scratch, did all the pre-surgical testing again, and still it appeared his seizures were originating in the left frontal region. He had electrodes placed within the brain, so it's rather than being on the scalp, they were actually within the brain to really pinpoint the seizure area. And we pinpointed it. It was close to language. So he did have further part of the left frontal lobe removed. And during parts of the surgery, so in the operating room, he would have to be woken up to test his speech. We did that with the help of Dr. Pearson, our neuropsychologist. It's a tricky thing to do. We don't have to do it often, but Alex actually did excellent. And I think it was something pretty challenging. With that surgery, by my account, it was a 40% further decrease in his seizures. So he certainly got better, but we still wanted to do more. So in 2018, you had the responsive neurostimulator, the RNS device placed. And that device, which I think Dr. Cheng will be telling you about further, over time it gets better. It's like it gets smarter. We're able to tell it when to stimulate with better accuracy. And so between the combination of the surgeries, the device, and some adjustments in his medications, really over the last 2 to 3 years, it's, again, what I had in my documentation was like 2 to 5 seizures a year. So that's from 2 a day
Wow.
to several a year. So that was extremely exciting.
It's huge, and we're going to get to everything that's brought into Alex's life, including camp, in just a minute. But first I want to bring in Dr. Cheng, because Dr. Cheng, you implanted that device in Alex's brain called the responsive neurostimulator. How does that work once it's inside the brain?
Yes, sure, thank you. So the responsive neurostimulator device is implanted into the brain. So part of it consists of electrodes that are placed either on the brain tissue or in the brain tissue where the seizures start. And then those electrodes are connected to a generator, or otherwise called a battery, that is implanted into the skull. So in this diagram here, you can see that that thing on the right side is the generator. And so what happens is that this reads the brain activity. It records the brain activity. And when there is a seizure event, the brain activity becomes very abnormal. There is a lot of abnormal, very excitable activity that the device can sense. And when it senses a seizure, the device sends an electrical stimulation back to the brain to stop the seizure from progressing.
So is this suitable for all epilepsy patients?
So it's currently not generally used for all types of epilepsy patients. For one reason is that it can be less effective than a surgery where we remove the brain tissue that's causing the seizures. In Alex's case, we have an overlap between the area of the brain causing the seizures and his language areas. So if we were to remove that area of the brain to control the seizures, we would be damaging his ability to speak. So often in cases such as this, where the brain tissue is very functional, we may consider the use of the responsive neurostimulator device.
This is really fascinating, and we just have to give props to Alex, because Alex, you were saying ahead of the start of this program, you used to be afraid of needles and didn't like going to the doctor, and here you are, you had brain surgery, you're not afraid of needles at all anymore. And a huge thing is now you're going to camp every summer. How cool is that? You must feel amazing.
Yes, I do, but it's it pretty much is a little frustrating, because like I said, it hasn't really been easy.
But you've come along. You've come a long way.
But I have come a long way since then. So,
why don't you tell them about all the things you can do now that you couldn't do before?
I I am sorry.
Don't be sorry.
It's okay.
We're in front of a lot of bright lights here. You're doing awesome.
So he used to not be able to stay by himself. He used to have to have someone with him all the time.
Yes, I did. Like I said earlier, I pretty much had restrictions.
And most of
Wasn't
those are
really able to go outside, and
now what can you do?
but now I can, and I'm able to swim with swim in a pool without a life jacket. I can stay home alone.
Where else do you get to go?
I get to go to summer camp, and pretty much whenever we're out at the lake, I can go tubing as well.
Oh, you can go tubing. That's
he got
cool.
to go tubing for the. He's always watched his siblings and cousins tube. He never got to go tubing, but this past summer, got to go tubing.
Hey, a lot of people don't like tubing because of the whip arounds, but you like that. You like the wild ride of the tubing?
Yes.
Get to hang on and get whipped around the lake?
Yep.
Yes, because I actually have figured out how to work the waves.
Yep.
I can just hang on to the tube by moving in the actual direction of whichever way the wave's coming from.
Yeah.
So
That's usually what people don't do.
Yeah.
Because you get
He's
scared. So
embraced
you
the
figured
fun.
out how to like redistribute your weight. He's mastered the tubing and how to last the longest on the tube.
I think he watched enough what
That's
the other kids
awesome.
are doing. He figured out how to do it. But,
So Gina, this must be so cool as a mom to see your son. You know, that's your little boy. No matter, Alex, even when you're 100 years old, your mom's still going to see you as your baby because that's what moms do, right?
Yeah.
Now to see your boy grow up to be a man who's going to camp and tubing and swimming, that must and have independence. That must be incredible.
yeah, it's been, like I said, this has been a life-changing couple of years for us. Alex's whole life, like we were talking earlier, Christmas, he had his first Christmas where he didn't have a seizure. And that, you know, he was 31 years old. So
Oh my gosh.
that just, you know, as a parent, it's sad when your child is at his happiest, bad things tend to happen.
Right.
So, sorry, for me, that's been the most joy I've gotten is watching him enjoy things and not have seizures. And
Right.
so that's been, like I said, for us, our whole family, it's been a joy watching Alex get to do fun things and be joyful and not worry that it's just going to come crashing down on him. So.
Well, I can't think of anything more cruel for a parent when you said at the beginning of the program that when he was most elated as a child was when you knew a seizure was coming on. Somehow those two came together, and that just seems so unfair. And now to have that freedom to feel joy and not have that happen is incredible. Dr. Cheng, do you continue to see Alex?
So actually, no.
Which is good.
He doesn't have to see me.
Right.
So we, I think more recently we replaced the device battery, the responsive neurostimulator device. So that was a simple outpatient surgery that was just working under the scalp to replace that generator that was implanted in his skull. And then we saw him in follow-up to make sure that the incision was healing well, but he's doing well, and he doesn't have a need for more surgery at this time. So That's why he just follows with Dr. Ochoa.
You want to keep seeing Alex, but not as a patient. You just want to keep seeing him because he's fun to hang out with. Dr. Ochoa, does Alex take any medicine now as part of his ongoing treatment?
He does. He takes quite a bit of medicine. So he's on 5 anti-seizure medications. We have tweaked those for, as long as I've known him. And I think for him, everybody's journey is different. And I think for some patients, one procedure or one aspect of the treatment is what really changes everything. But I feel like for Alex, it's been sort of these building blocks that have worked together. So luckily he tolerates the medicines very well. We are always talking about side effects and what to look out for. And, if another person took as much medicine as he did, they might not feel well, but he tolerates them quite well. I also just want to take a quick moment to say that it's a joy that, it's the best part of my job to be able to hear, when you guys would come into the office and you told me about that first Christmas, or you told me about, what you were able to do at the lake that you weren't able to do before. And most of all, that you were alone, because, imagine if you could never be alone.
Right.
We all need to be alone sometimes. So it's just an honor to experience that with you.
And to have your independence. We are here to answer all of your questions. We know our viewers have some excellent questions. You can reach us on YouTube, Facebook, the X platform. You can email the Medical News Network. We're answering your questions in real time. We're going to get to those in just a moment. So not only does Dr. Stites have the day off, though, so does Dr. Dana Hawkinson. I wonder where those two guys are today. Maybe they're out somewhere having fun together. We want to remind everyone that this week's COVID count here at the health system is 15. So we've been going anywhere between 15 and 20 patients for the last several weeks. Both Dr. Stites and Dr. Hawkinson will be the first to remind you to stay up to date on your vaccinations, flu shot, make sure you're current on your COVID vaccine as well. And with that, let's get to the questions. Do we have any reporters on the line today? No reporter questions, so let's get right to our community questions because we have several. Jean has an interesting question. Dr. Ochoa, I'm not sure if you're familiar with this. It happened in pop culture, but can you say anything about the recent seizure that Brooke Shields had? She attributed it to dehydration. No, she attributed it to overhydration, drinking too much water. Is that possible?
It is, and so, not treating her, not knowing all the details of the situation, if it's provoked by something like that, that is not expected to happen again, as long as you don't drink another, 2 gallons of water, that's not epilepsy. Epilepsy is when your brain has a higher tendency than average to have seizures, and you don't need any external factors for it to happen. And so we call that a provoked seizure. And yes, there is, everything in excess can be bad, so even water. And so if you drink way too much water, your sodium can go down. And when it's down significantly, that can provoke a seizure.
Well, how much is too much water? I got to ask because I carry one of these around all day, and I feel like if I finish this as a good day, is this too much water?
Well, that's a good question. Typically, we say like 8-ounce, glasses. Okay. You also have to remember you get fluids and water in your food. So things like fruits,
that counts
that
as
have
water.
It does.
Okay.
And then you also have to take into account the amount of salt that you take in, because the salt and water is a balance. So if a patient's having a no salt diet and they're having, like I said, 2 gallons of water, that's probably going to be too much. But
Scott,
I would say it's individualized.
Individualized, okay. Scott has a question for Alex. Scott wants to know, Alex, where do you go to camp?
I go to Wonderland Camp. It's pretty much
It's at
at the Lake of the Ozarks.
Yeah.
They also have different themes, but I prefer to go to the pirate theme
You love
every
pirates.
summer.
Yeah, I highly recommend it if somebody's got
The Wonderland Camp.
has even a young adult. They're all ages there. There's no
sounds like
age restrictions. It's a wonderful camp, yeah.
Yen Liang has a question for our doctors. Yen would like to know, would a stroke ultimately cause or lead to epilepsy? Dr. Ujoa, Dr. Chang, who wants that one?
I mean, I would say it's just a yes. It can. It increases your risk of epilepsy, and it can happen immediately, you know, within days of the stroke, even hours of the stroke, or it can happen delayed, you know, 10, 20 years after the stroke, because those changes are there. The vast majority of people with strokes won't develop epilepsy, but it's absolutely a risk factor, and we see many patients like that.
Jeremy has a question. Jeremy wants to know, and this is really interesting. He writes, it seems like epileptic seizures are one of those things we have a lot of mistaken ideas about from movies, like swallowing your tongue or something, which I thought is a myth. So tell us, is that true? And if someone you know has a seizure and you're panicking, what do you need to do to help that person if they're having a seizure? That's really interesting. I remember seeing in a movie once someone put a credit card in the person's mouth to. Is that a myth that you need to put something in their mouth?
Not only is it a myth, but it's dangerous.
Okay.
So really, it's pretty simple. You want to make sure that the environment around the person is safe, that they're not going to hit themselves. So, you know, lowering them to the ground, turning them on their side. That way, if there's a lot of saliva or even vomit, they won't aspirate it. Timing the seizure, because past 5 minutes we consider that a medical emergency where you need to call 911. And so really it's just an overall keeping the person safe and keeping an eye on the watch. You don't want to put you cannot swallow your tongue. That's not a thing. Okay. A seizure can definitely affect your breathing, but not because of the tongue.
And then Stuart has a question. How dangerous are seizures? If someone's having a seizure and no one's around to see it or help them, how dangerous is that situation?
Well, I think it's actually quite a loaded question, because I think when you ask doctors this 20 years ago, and I see many patients like this, a parent that asked their doctor, is it dangerous to have a seizure? And many of them tell me that they were told no. And so I think we have moved away from that quite a bit. It is rare to die from a seizure, but we know it's possible, both through injuries and drowning, but also through something called SUDEP, sudden unexpected death in epilepsy, which it's a hot area of research right now, and we find that it's cardiopulmonary, how the lungs and your breathing and oxygen are altered, and how your heart rate is altered, that can lead to that. And so again, death in epilepsy is luckily an infrequent situation, but when you're an expert in it, you certainly see it happen. Mm-hmm. But I think the injuries, and then also the brain doesn't like to have seizures. So very commonly, if someone's seizures are not stopped, they will develop memory problems. That's probably the most common issue that we find long term. And if you don't stop them, that can just kind of gradually get worse.
Interesting question from Jean. And Jean, this is for Gina. Mm-hmm. Jean wants to know if you ever discovered there was a connection between the epilepsy and the autism, or are they completely unrelated?
Well, at first we were told that they're unrelated, but with Alex was originally diagnosed with Asperger's syndrome. That's what it was back in. He was 6 or 7 years old when he got diagnosed with autism, and then we were told that if you take the general population, the number of people in the general population that have epilepsy is lower than if you look at just the autistic population, that percentage is higher. So nobody's ever come out and said yes, that that's what caused it, but there seems to be a higher likelihood that you could have epilepsy and autism at the same time. We've discovered several people that, like Alex, have autism, and their children also. Their epilepsy isn't as severe as his is, but yeah.
This is such a fascinating discussion, and I'm so grateful to all of our guests for being here. Alex, thank you for taking the time to join us. I want to ask everyone for their final thoughts as we wrap this up. Alex, I'm particularly interested, though, in a pirate joke that you told me before the show began of you wear this T-shirt on St. Patrick's Day?
Yes, I actually wear a shirt that says I'm Irish.
I'm Irish.
And
Oh, we have the same sense of humor. I think it's funny.
He does like that shirt.
Yeah.
yeah.
So you have a pirate T-shirt for every day of the week?
Yes.
Just for camp.
Yeah, just for camp, sorry.
Don't be sorry. Oh my gosh, we're in the home stretch.
You're
You're
good.
doing awesome.
All right, bud.
Yeah.
You do like your pirate shirts.
Yes, I do. I have one for every single day that
That you're at
I'm
camp.
at camp.
Yeah.
Mom, Gina, that must be just awesome. What would be your final thoughts as we wrap up this discussion for people watching?
I think I'm just so thankful that we came here. We came to the University of Kansas. We came 25 years ago, and really glad that we found you all, because like I said, our lives have been so different this last 2 years, and we see Alex becoming more independent. And if anybody knows anyone who's looking, this is a great place to come. I don't know that where we would be had we not come here. So it's great watching your son become independent like he is. So,
Dr. Ulloa, you've said that this is one of probably the favorite part of your job is seeing people living their full best lives. Anything you want to say to Alex or to Gina?
Thank you. Like I mentioned earlier, it's really an honor to watch you grow. And then I want to say thank you to Dr. Chang, because I feel very lucky to work with her. She's excellent. There's not too many women neurosurgeons, and so I'm very proud that we have one of the best here.
You can say it.
Yeah.
You can say it.
Oh, and one of the patients I worked with called her a badass, and I just think it's the best term for her.
It's the highest compliment I think you could give another woman, and a doctor like Dr. Chang. I mean, you are. Let's face it. Dr. Chang, what would be your final thoughts for viewers watching?
I definitely agree that I think one of the things we always want to emphasize is that epilepsy can be treated. If you're on medications, but that's not treating your seizures well enough, it's good to seek care at some place like KU. So some place where they have a comprehensive epilepsy program, and that we can really try to investigate the different ways that we could treat the epilepsy. And this field is growing so much. There are so many changes. The devices, like the responsive neurostimulator device, are relatively recent. So it's very exciting to be in this field and to be able to help take care of patients like Alex.
Well, thank you so much to all of our guests for joining us. Alex, thank you for sharing your journey. And as we wrap up this discussion, remember, as Dr. Stites always says, faith, hope, and science. And I'll see you back here tomorrow on All Things Heart. Years after facing 2 major heart issues, this doctor got a devastating blow. I'm Alexis Del Cid on the next All Things Heart, how he went from making end-of-life plans to fulfilling his lifelong dreams, thanks to his cardiologist right here at the health system, Thursday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.